Hello, my name is Dr.Fraum, and I'm an assistant professor of radiology with appointments in abdominal imaging and nuclear medicine at Washington University School of Medicine in St. Louis, Missouri. I specialize in oncologic imaging with a focus on MRI and PET studies. Hi, I'll be addressing the question of what would make me ineligible for an MRI scan. So MRI, or magnetic resonance imaging, is a radiology study that makes images of the body by taking advantage of the magnetic properties of human tissues. Think of an MRI as a much larger and stronger version of the magnets that you see and use in your everyday life. Also think about how the magnets that you encounter interact with objects around you. Magnets stick to the door of your refrigerator because the type of metal contained within the door interacts with the magnet itself. When placing a typical magnet on your refrigerator, you never worry about the magnet pulling the refrigerator away from the wall toward your hand because those magnets are not very strong. In contrast, the magnets in MRI scanners are so strong that they can twist or dislodge certain types of metal objects that may be in your body. This twisting or dislodging can cause serious tissue damage. MRI scanners can even pull heavy metal objects toward them from across the room. The strong magnetic fields can also generate electric currents in certain types of metal wires, creating the potential for burns. This may sound scary, but MRI can be a very safe and highly valuable imaging study if appropriate precautions are taken. As such, it's critical that access to the spaces containing MRI scanners be tightly controlled. Only certain types of medical devices are permitted in these spaces. It's important to note that not all types of metal are affected by magnets. For example, medical devices made of titanium do not interact with magnetic fields and therefore are not problematic from an MRI safety perspective. This is the reason that it's important for MRI staff to have detailed information about any metal implants or devices that might be in your body. It's also important to know about any prior injuries in which metal, such as metallic shavings, BBs, bullets, or shrapnel, may have become lodged in your body. To address these issues, all patients scheduled to undergo an MRI are required to complete a questionnaire or have someone who knows their medical history completed for them. This form asks you to describe any injuries in which a metallic object might have become embedded in your body. It also asks you to describe any prior surgeries or procedures that you've had so that technologists can check devices and implants for MRI compatibility. If you have any documentation pertaining to previously placed devices or implants, you should bring that with you to the MRI team to review. For example, many pacemakers come with an ID card that can fit in a wallet and should be kept with you at all times. Beyond certain MRI incompatible implants and devices, there are some other reasons why someone might be ineligible for an MRI. For example, patients who are pregnant, have severe renal dysfunction, or have a history of severe allergic reaction during an MRI may be ineligible to receive MRI contrast material. In such patients, an MRI can be performed without contrast material if the radiologist thinks it would still be valuable when done in this way, or another type of imaging study such as a PET, CT, or ultrasound could be performed instead. Other potential reasons a patient might not be able to receive an MRI would include severe claustrophobia or morbid obesity, as the opening in the scanner where a patient is positioned during imaging is a relatively small and confined space. Patients with claustrophobia can potentially be medicated to help them tolerate the imaging procedure. Also, patients with medical conditions that make it hard for them to lie flat for extended periods of time, such as heart failure or severe back pain, may not be able to tolerate getting an MRI, which generally involves lying flat on one's back for 30 to 60 minutes. Finally, patients with confusion, dementia, or other forms of altered mental status may not be good candidates for MRI due to their inability to remain still and follow instructions during the scan. So to summarize, there are many potential reasons why it might not be safe or useful to get an MRI, and it is especially important for patients to complete their MRI safety questionnaire in a detailed and complete fashion to help the MRI staff identify these issues and take appropriate precautions.